Sudhakar. I am a consultant nephrologist at Aster Prime Hospital, Hyderabad. So next question is, how do we recognize what are the symptoms of CKD? Unfortunately, when the kidney function is damaged up to 50%, then only we get some of the symptoms of chronic kidney disease. The earliest symptoms that we get are sometimes blood in the urine, or swelling of the feet, or high blood pressure, or not able to eat, anorexia, or loss of appetite, or sometimes loss of memory or impairment of memory may be the earliest manifestations of chronic kidney disease. If any of these symptoms are there, then some tests can help in confirming the diagnosis. If we test the urine, presence of protein or albumin is a significant abnormality and suggests chronic kidney disease. If blood test called serum creatinine usually confirms the diagnosis of chronic kidney disease. In a patient in whom we have diagnosed with chronic kidney disease, the treatment usually consists of two parts. One is dietary advice, second is medicines. The dietary advice, most important thing is they have to control salt in the diet. Normal average South Indian diet contains approximately 10 grams of salt. So that should be reduced to at least 3 grams per day. Second important thing is potassium containing foods should be avoided. Like for example, a patient should not take coconut water or lemon water or oranges. These contain more potassium, so they should be avoided. Coming to the medicines, now we have very potent medicines which are helpful in the treatment of chronic kidney disease. The blood pressure should be controlled very well. Nowadays, recently, the medicines have come like AC inhibitors, ARBs, mineralocorticoid receptor antagonists. These help in control of blood pressure, but they also help in the preventing the progression of chronic kidney disease. If a person is suffering from diabetes, the diabetes sugar should be controlled. Some of the recent medicines we have in the armamentarium are like SGLT2 inhibitors. They not only control the sugars, but they also help in preventing the progression of chronic kidney disease. If the chronic kidney disease reaches end-stage renal disease, that is what is called end-stage renal disease, then they should go for dialysis or kidney transplantation. The dialysis and kidney transplantation, they involve a lot of expenditure and strain on the kidneys and the patient's resources. So the best thing is we should try to prevent the development of chronic kidney disease or CKD. How do we do that? If a patient is having diabetes, then sugars should be controlled well. When the sugars are controlled well, they may not develop the chronic kidney disease. Likewise, if a patient is having high blood pressure, the blood pressure should be controlled, and if the blood pressure is under control, they may not develop the chronic kidney disease. Third most important, they should avoid smoking. Fourth, if the patient is overweight or obese, the weight should be brought down to normal levels. Over-the-counter medications like painkillers and antibiotics should be avoided. So these are all some of the simple things which can help in the prevention of chronic kidney disease. The best thing is sometime after the age of 40 years, frequent medical checkups can detect chronic kidney disease in very early stages, and that will be helpful in preventing the progression of chronic kidney disease. Thank you very much.